It's my understanding that vitamin D3 enhances calcium absorption. Is that correct?
Vitamin D3 is absolutely essential. Now they say that the average woman and man should have about 2,000 units per day in their diet, independent of sun exposure. The reason for this high level of vitamin D is really not understood clearly. We only know that the vitamin D that circulates in your bloodstream is too low when you're just doing sun exposure. So the recommendation now is 2,000. But more importantly, I think that every woman and every man needs to have, as part of their physical exam, they should have their serum levels of vitamin D looked at so that they can measure how the vitamin D that they're taking in orally or that's being produced based on your exposure to the sun
is actually being
is
absorbed.
actually not absorbed, being metabolized. So what happens is vitamin D is activated on the skin, or it's taken in as vitamin D3, and then it goes into the liver, and then the liver processes it and breaks it down and produces a metabolite, what's called a prohormone. It, in turn, that prohormone circulates through the body and goes to different areas of the body, like the intestines, the kidney, the brain, the breast, the prostate, where it goes into those cells and it plays a very profound role in stabilizing those organ systems. That's why when you read the literature on vitamin D, it appears to be a panacea. That no matter where you look, there's some study showing vitamin D is implicated with cancer risk reduction. It's just remarkable, be it prostate, be it breast, be it ovarian, be it uterine, immune depression, it's autoimmune disease. Vitamin D is like part of that question. So how do you manage vitamin D? You don't go 2,000 units. You find out if your range of vitamin D is within a range that promotes health. Another area that vitamin D...
And excuse me, and this would happen from the blood serum tests?
Yes.
Okay.
You would see the metabolite of vitamin D in the blood, and that would tell you whether or not there's adequacy there. It doesn't tell you whether the target tissue that the vitamin D is going to go to is actually going to get the full benefit, but it's a start.
It's a start, and
yes.
it's a way to generally understand. Now, if people, normal folks out in the Midwest or whatever, is going to go to their physicians and ask for a blood serum test on D3, are they going to be?
They'll ask for 25 cholecalciferol.
25
cholecalciferol.
Okay.
And that's not the actual vitamin D, which is cholecalciferol. It's 25 cholecalciferol.
Okay.
It's the metabolite.
Right.
And that ultimately is what doctors will be asked to test for routinely.
Okay.